Also new here at noon, chief medical officers warn if community spread of COVID-19 does not slow down, our local hospitals will soon run out of beds. KCTV5 stands for you. Our Savannah Rudisell talked directly to the experts about this problem and the potential solutions.
Kansas City hospital leaders agree now is the time to take those health guidelines seriously. That includes wearing a mask, washing your hands, and figuring out alternative plans for Thanksgiving. They say if Missouri's positive COVID-19 case rate continues where it is, hospitals could be overwhelmed within weeks.
We are at a critical juncture between concern and crisis. And unfortunately, that needle is trending more and more toward crisis.
Chief medical officers from across the metro met virtually Friday to tell elected officials hospitalizations of COVID-19 patients are the highest they have been in Kansas City since the start of the pandemic. They say we're at risk of hitting a critical point in care.
This is going to become even more difficult as we enter the winter months and more of our time is spent indoors in those crowded conditions.
Hospitals may hit capacity within a few weeks if the positivity rate trends upward.
Between 25 to 30% of our medical beds are taken by COVID these days.
The problem here isn't so much the number of beds, but the number of employees to staff those beds. Some providers are cross-training or hiring more care staff. Kansas City may even need to call in nurses from across the U.S., just as New York City and New Orleans did in April, if we have a winter surge. The chief medical officer with Truman Medical Center tells me that one thing he's really watching out for is his staff burning out. He says he's working to get them all the additional resources they could need. Reporting in Kansas City, Savannah Rudisell, KCTV5 News.